Good afternoon, everyone. Our apologies for the delay, but welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Henshaw, Chief Medical Officer of Health for the province. Dr. Henshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I get to today's numbers, I would like to remind Albertans that when seeking health care, it's critically important to disclose COVID-19 symptoms if you are experiencing them. We don't want anyone to delay getting new or worsening health issues looked at, and to protect everyone involved, we have protocols to safely care for confirmed cases of COVID-19, close contacts, and anyone with symptoms. However, if a patient doesn't disclose their symptoms or their status, health teams are left in the dark, and those safety protocols can't be enacted. This puts the care team and other vulnerable patients at risk. As we get excited about the summer and see dropping case numbers and climbing vaccination rates, it can be easy to forget the ongoing threat of COVID-19, particularly in acute care centres. But we must continue to be mindful of our symptoms and do the right thing. Stay home unless healthcare is needed, get tested, and disclose those symptoms as needed. This will help you get the care you need and keep everyone caring for you safe. Turning to today's numbers, we have now administered more than 3.1 million doses of COVID-19 vaccine in our province. 67% of all Albertans 12 years of age and older have at least one dose, and 15% are fully vaccinated with 2 doses. Over the last 24 hours, we have identified 139 new cases of COVID-19 and completed about 3,400 tests. Our positivity rate was about 4.2%. Last week, the R value for the province was 0.74. This includes 0.75 in the Edmonton zone, 0.73 in the Calgary zone, and 0.73 for the rest of the province. These are great numbers, signs that our efforts to reduce the spread of COVID-19 are working. We continue to screen all positive samples for variants of concern and have identified 74 additional cases in the last 24 hours. There are currently active alerts or outbreaks in 241 schools, representing 10% of the schools in the province. There are 336 people being treated for COVID-19 in hospital, including 85 in the ICU. Sadly, I must announce that 3 new deaths were reported to Alberta Health in the last 24 hours. They were between the ages of 48 and 68. My thoughts are with the family and friends of these Albertans as they mourn their loss. I also extend my sympathies to anyone who has lost a loved one recently from any cause. These deaths remind us of the risk COVID-19 continues to pose in Alberta, especially for those not yet vaccinated and those vaccinated within the last 14 days. The good news is that our immunization program continues to administer more doses each day, and the number of people fully vaccinated with 2 doses is rising sharply. The other good news is that our leading indicators continue to trend downward. There are currently 4,431 active cases in the province, the lowest we've seen since March 9th. That's over 20,000 fewer active cases than we had just 1 month ago. What's more, our positivity rate has averaged 4.5% over the last 7 days. That's a sharp drop from the average of 11.7 in early May. Most importantly, Alberta's average positivity rate is declining in all zones, which indicates that progress is being made province-wide. All of this tells us that our growing immunization program and our public health restrictions are working together as planned and limiting transmission. I know there have been some questions recently about the B.1.617.2 variant, also known as Delta, and I want to talk about what this means for our province. This variant is not new to our province. We identified our first case in a sample taken on April 8th. Since then, we have identified 193 cases of this B.1.617, which was originally identified in India. The majority are most likely the substrain B.1.617.2. We also know that BC and other provinces are seeing cases of this variant even as their overall numbers continue to fall. Right now, AHS has identified 16 cases of this particular variant in patients on 2 units at the Foothills Medical Centre. 4 healthcare workers have also tested positive. These are 2 separate outbreaks, and most cases are experiencing mild COVID-19 symptoms. It appears that all but 1 case are hospital-acquired, so cases were in hospital for other reasons before their infections. As with all other outbreaks in acute care settings, AHS has implemented strict outbreak protocols to protect the health of everyone involved. The good news is that these protocols are working. There have been no new cases on one of these 2 units since May 20th. The hospital remains open for patients and safe for those receiving care. This variant is emerging around the world, and evidence does indicate it is more transmissible. Given that, we need to watch its spread as we do all COVID cases. However, I also want to put our numbers in context. Of all the variants of concern identified last week, only 5% of them were the B1617. It is still a very small proportion of our cases. Research is still emerging for this variant with respect to vaccine effectiveness. Current evidence seems to show that first doses are somewhat less effective. They still appear to provide some protection, and the good news is that 2 doses are virtually as effective against B1617 as any other strain. This underlines the importance of our rollout of second doses, and we are looking at whether we can accelerate this timeline even further. In the meantime, we are focused on tracking and identifying all cases as quickly as possible. Right now, we have one of the most aggressive variant testing strategies in Canada. We are screening 100% of positive cases for variants of concern, including the B1617. Any identified non-B117 variant of concern cases are also receiving 2 follow-up calls to help identify contact tracers, aggressively contain this virus. The bottom line is that while any new variant is a concern, we can still work together to stop transmission. Albertans can help by getting vaccinated. If you haven't got your first dose yet, this is the time to do it. And if you're eligible for a second dose, please book it now. Don't wait, as many more people will soon be booking second doses. The faster we can do this and the more Albertans who are vaccinated, the safer we will all be. In the meantime, we all need to keep limiting the risk of transmission, even when vaccinated and even when doing things that are allowed. If we all wear a mask, stay distanced, avoid groups indoors, and always stay home when we're feeling even a little bit sick, we can make a difference. We have come far and we're seeing real progress. If we all do our part, we can continue to keep cases decreasing and measures safely easing to keep everyone healthier in the weeks and months ahead. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through our first caller, please?
First is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. There are thousands of unclaimed appointments for first-dose vaccinations in Alberta this week. Will you open up eligibility for second-dose vaccinations to fill these appointments?
We are looking at possibilities of second dose timing and considering when we might be able to start the next round of second doses. We do want to make sure that anyone who hasn't yet received a first dose who is looking to do so has that chance. So I would really encourage anyone who hasn't yet had a first dose to book their appointment soon as we consider the timing of that options for possibly accelerating second dose appointments.
Kevin, is there a follow-up question?
Yeah, I'm wondering, as you say, you're leaving availability for people who haven't received their first dose yet. Is your sense that there are people who still want to receive their first dose who haven't had the chance yet, in that they've probably been eligible for several weeks at this point?
What we know is that people choose to get vaccinated for various reasons and on various timelines. We know that some people who may have tried to book an appointment at some point in the past and perhaps there wasn't an appointment that was conveniently available at that particular moment in time maybe sort of put that on pause and went to do other things. And this is a reminder that now is the time. Again, there are appointments available, and so I know that we are continuing to get people coming forward and booking those first dose appointments, and would encourage people, again, to make sure that they're booking them as quickly as possible so that they can find a time and place that's convenient for them before we do open up for additional second dose appointments.
Operator, could you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Just jumping off Kevin's question, he talked about the possibility of moving up that second dose timing. We know that now all positive cases are being screened for variants of concern, and there's been a noticeable jump in the Delta variant. Doctors have said that there is greater protection against the Delta variant with the 2 doses. So how exactly is the province looking at moving up those timelines, speeding up those timelines? What would that look like?
Again, it's really about making sure that we are giving every opportunity to people who want that first dose to get that protection, which in general, overall, as we can see from our vaccine effectiveness results in the province, that we are seeing that 70 to 80% protection from the first dose for the vast majority of the COVID-19 virus strains that are circulating in the province right now. And so we want to make sure we're giving people the opportunity to take advantage of that protection, that 70 to 80% protection, at the same time as knowing that the second dose solidifies that, increases it to 90% or more, and particularly for this particular B1617 variant, increases even further as that first dose doesn't seem to achieve that 75-ish% protection that we do see against some of those other strains. So again, it's taking into account that encouragement for first doses and then using available appointments to accelerate, as we're able, those second dose opportunities for people, but wanting to make sure we're balancing both of those things, because those who haven't yet had the chance to access that protection for themselves and others of that first dose, we want to make sure they have every opportunity to do so.
Julia, is there a follow-up question?
Yes, there is, on a slightly different topic. Just wanted to gauge your level of concern with the cases of the Delta variant in Calgary hospitals, and what more can be done to prevent further spread.
It's interesting, as I mentioned, there are 2 outbreaks right now in the one hospital, and one of the outbreaks has very small numbers, has not spread further, and the other outbreak, again, we're still investigating, so it's not clear exactly what all the factors are, but perhaps there had been some spread before the index case was identified. But the interesting thing about those 2 outbreaks is that we can see that with the implementation of aggressive control measures, promptly spread is stopped. And so again, I think there's a reassuring message with respect to, in some ways, that tale of 2 outbreaks, that when we identify the infectious index case and we put those measures in place, there is no further spread. And unfortunately, if there is an index case where the infectiousness isn't promptly identified, that we do still need to be cautious and careful, and particularly in settings of high risk like acute care and like continuing care. And that's exactly why, again, I'm reminding people that as we are continuing to ramp up our vaccination, we do need to continue to follow all of the appropriate public health measures in every setting that we're in right now.
Operator, could you put through the next caller, please?
Next is Alessia Pasasume with Globe and Mail. Go ahead, Alessia.
Hi there. My question is just, how concerned are you about the reopening plan, more specifically Stage 3, as large group events are able to operate, like the Stampede in Stampede in particular, in fueling cases that can force additional restrictions in the fall?
When we look at the plan that we have going forward, again, it's based on the additional protection that vaccines offer, and the way that the different stages were planned was to start out with a very cautious initial approach. So you'll see, if you compare the staged reopening to neighboring provinces, that in our Stage 1, we have retained a lot of additional measures and protocols where other provinces have gone further to ease measures earlier, given that they started out with slightly lower case rates. And so our approach has been to drive our cases down as low as possible by keeping those more aggressive control measures in place at the beginning. And we're seeing that, again, combined with vaccines, work to drive down those cases. And then as we move forward, again, we retain those measures in stage 2. And even in stage 3, we will continue to have recommendations. We have been working with the Calgary Stampede organizers for several months to make sure that we're thinking through ways of mitigating the risk of significant spread in that venue. And it's not going to be the Stampede as typically would happen. Most of it's outdoors. Again, there are measures in place to limit the chance of further spread. And so again, wanting to make sure that we're clear with Albertans that this is a gradual easing of measures, and that even moving into stage 3, people will still need to be thinking about managing risk, just as we manage risk every day in every aspect of our lives, and continuing to ramp up that second dose protection as quickly as possible to make sure that we do have that population level protection in place.
Alessia, is there a follow-up question?
Yeah. Are you worried about province-wide transmission? So if folks are coming from out of province to go to the Stampede, say from British Columbia or Ontario, and might be bringing in the Delta variant, which we know one dose is only giving people 33% protection, I'm wondering how worried you are about that.
When we're looking at the summer, we're seeing all provinces ease their planning to ease their travel recommendations or requirements at different stages, depending on the province's context. And so I actually think that the Stampede is not going to be the kind of biggest risk as we're looking at people traveling. One of the things that people have said that they miss the most is seeing their friends and family members. And so I think this summer we're going to see a lot of people traveling across multiple provinces, wanting to stay with friends and family, having those indoor social gatherings. And so the best thing that all of us can do is make sure, again, that we're accessing the protection that vaccine offers us, and thinking through as we're making our travel plans how we can mitigate risk if, again, depending on where we're traveling, if there's spread. So again, the summer is going to continue to be a time of us in the transition between responding to the significant threat that COVID-19 has posed into a time where we have a level of protection that allows us to manage that risk, again, as we do the risks of many other things in our lives.
Operator, could you put through the next caller, please?
This is Carlisle Facette with CTV. Go ahead.
Hi, Dr. Hinshaw. I'm just looking at the case numbers, for example, in the United Kingdom right now. In the last couple of weeks, they're trending in the wrong direction, and a lot of that seems to be driven by the Delta variant. And that's a country that's well ahead of us when it comes to second doses administered. So given how little, as the previous reporters have mentioned, when it comes to 33% protection of just one dose, when a country that's way ahead of us when it comes to second doses is seeing their cases go in the wrong direction, what does that make you think when it comes to a possible fourth wave here in Canada and Alberta specifically?
I think it really highlights the importance of watching for emerging issues, but also being mindful of the shift that all of us are going to need to go through in the coming months, because we have been very used to watching cases with an automatic translation of cases into acute care and severe outcomes. And the vaccine does two things. One of the things it does is it prevents transmission, but the other thing that it does is those who get infected are less likely to go on to have severe outcomes. And so the other interesting thing about the UK is that while cases are starting to go up a little bit, we are not seeing that same corresponding jump in severe outcomes. And I think, again, that's a shift that we're all going to need to be moving into, is making sure that we're thinking not just about cases, but also about what those cases lead to, because we know that restrictions, public health measures, have health consequences of their own. We know that the measures have significantly impacted many, many Albertans, and we need to be mindful of balancing all of the different health impacts of the measures as well as COVID-19 as we make our plans going forward. And so again, I think we can learn from the UK, but we need to learn not just by being concerned about cases alone, but watching how, as their situation unfolds, how that informs our focus on increasing vaccination rates in areas where maybe there's not been the same kind of uptake, as well as making sure that we're not just reacting to cases, but reacting to the outcomes of cases when, thankfully, vaccine can help disrupt that connection between cases and severe outcomes.
Carlisle, is there a follow-up question?
Yeah, and this might be sort of a similar type of reasoning, but when it comes to our R value, I know it's still in a much better spot than it has been given some of the spikes during the previous waves, but it is also creeping up. But I'm wondering then, is it a similar idea? Are we expecting our R value to continue increasing, but maybe that doesn't tell the whole story when it comes to severe illnesses because of the coverage of vaccine?
So it's important to remember that as long as the R value is below 1, cases are declining. And so even though the number has gone up slightly, it means that we're not dropping as quickly as we were before, but we are still dropping. So again, though, that is a measure just of overall cases. It's not a metric that looks at severe outcomes at all. And so we do see, again, we're sitting around that 0.73, 0.74 mark. That our case counts continue to drop at a significant rate, and we would expect, again, that our rate of decrease would slow a little bit as we get into smaller and smaller numbers, simply, by a factor, again, of the fact that the percentage of, change from day to day or week to week automatically gets smaller as those numbers get smaller.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Danielle Germano with the Canadian Press. Go ahead, Danielle.
Hi, Dr. Henshaw. The Edmonton Zone Medical Staff Association has asked the mayors of Calgary and Edmonton last week to keep their mask bylaws until 70% of their eligible population is fully immunized. Having you discussed that the Delta variant the first dose isn't as effective on the Delta variant. Should the province reconsider an opening plan where it's 70% of the total population with 1 dose?
I want to be clear again, the 70% with at least 1 dose did factor in other considerations, such as the proportion that's increasing over time of those who have their second dose, as well as those who have post-infection immunity, some level of that. Again, as always, wanting to be clear that we know that getting immunized after having had an infection increases overall protection, particularly against variants, so it's still recommended. But we can't ignore the fact that there is some protection after having had an infection, and that is also factored into the plan. So with all of those pieces kind of going in, second doses, first doses, and the post-infection immunity, it's again important that we're watching the emergence of the B1617 variant, where we're paying attention to how it's acting, watching it closely. It is a very small proportion of our overall cases right now, and we are continuing to do aggressive containment through our contact tracing. But again, looking forward and considering what would happen post-stage 3, again, I want to make sure that people understand that the shift that we're needing to make is looking at how we can learn from how we've protected each other during this pandemic and taking those lessons learned forward. So the absence of legal requirements doesn't mean that we stop protecting each other. We still need to be courteous and respect each other's needs. And that could mean masking in certain settings, even if it's not legally required. Again, that's something that can continue to happen to protect each other as we move forward and kind of past the acute phase of the pandemic.
Danielle, is there a follow-up question?
Yes, Premier Kenney said yesterday that the demand for the first dose has dropped, and another 115,000 appointments need to be made within the next 6 or 7 days in order to reach the threshold for the final stage. So with that that drop in demand, as well as concerns from definitely Mayor Iveson has expressed concerns about coinciding some bylaws with the reopening plan. So what do you have to say, additionally have to say to people of those two cities, as well as the rest of Alberta, who are concerned that the reopening plan perhaps is too fast, considering all those things?
I think that we have been, again, in an unprecedented time. Most of us have never lived through the kind of disruption that we've lived through in the past 15 months. And it's totally natural to look at the measures that have been in place as the only things that provide us safety from COVID-19. And the plan that was built was laid out on looking at other jurisdictions, looking at the experiences that other jurisdictions have had after opening at different levels of protection, and then building that into the Alberta context. And so I think, again, it's important to move forward on this together. The fact that many of the CMOH orders will be lifted in stage 3 doesn't mean that COVID-19 goes away. COVID-19 is something that will be managed as we manage many infectious diseases at a local level with public health expertise in our public health teams. And that kind of infrastructure stays with us and doesn't go away even after these extraordinary measures are lifted. But we need to remember that we have always been in a balancing situation where the measures, while they protect against the direct impacts of COVID-19, have other health impacts as well. And so we need to be shifting, thinking about that future going forward, where COVID-19 is one respiratory virus among many. We're managing our risks going forward. We're supporting each other to do so. We're supporting each other to wear masks. Again, in indoor environments where people are in crowded spaces. And those kinds of things can be lessons taken forward from how we've protected each other for the past 15 months. And we don't necessarily need those legal requirements that have extraordinary reverberations to help us to protect each other in that going forward time.
Operator, could you put through the second last caller, please?
Jesse Wisner with Global TV. Go ahead, Jesse.
Hi, Dr. Hinshaw. I'm wondering, how will variant screening and the variants of concern identified play a role in reopening, especially with the Delta variant and the less effectiveness of one dose?
As I mentioned with the universal screening for variants of concern, we are paying special attention to the P1, the B1351, and the B1617. Those are the three, again, in the alternate terminology, known as the beta, gamma, and delta variants. And so those three, when they're identified, there is a second phone call from our case investigator to let the case know that they have a variant of concern that's not our currently dominant strain, which is, again, that alpha or B117 variant. And there's extra work then to make sure we understand where those cases are spreading, to do additional containment work. And those are the kinds of measures, especially as we see our overall case counts reduced, that can help us to minimize the spread. But I want to reinforce that it is critical that all of us follow the public health measures that are currently in place. And as we move into stage 2 later this week, it's so important for people to remember that the restrictions are in place for a reason. And even though we're seeing this particular variant, which again is a very small proportion of all of our cases, raise some concerns, all of the other variants and the wild-type COVID, all of those are viruses that we still need to be concerned about as well until we've reached the level of protection that vaccines can provide us. So again, we still have measures in place. It's still important to follow them, not just for the Delta variant, but for all COVID-19 cases.
Jesse, is there a follow-up question?
Yes, there is. A little bit of a different topic. About 50% of younger Albertans between the ages of 12 to 34 years old have at least one dose. Appointments to this age group have been open for a few weeks now. So what may be responsible for those low rates?
We've heard various things from groups that work with or represent younger Albertans. Sometimes people think that because they're younger, they're not personally at risk and don't necessarily see the urgency of being immunized. And sometimes, again, it's about perhaps they've tried to get an appointment when they were first eligible and weren't able immediately to do so, and then other things have come up and they haven't tried again. So we are working to see how we can make access to vaccines as efficient as possible, as barrier-free as possible, and working on the communications campaigns that we have underway to make sure that people in that particular age group are aware of the protection that they can get, as well as the protection that it provides those around them. And so we continue to, again, work on the convenience of offering vaccine, as well as making sure that people in that age group know how important it is, and that the impact of them stepping up to get vaccines is that we get closer and closer to being able to do the activities that they and all of us have missed.
Operator, could you put through our final caller, please?
Final question is Andrian Williams with CBC French. Go ahead, Andrian.
Hi, my question was kind of asked by my colleague, but I'll re-ask it again. Dr. Hinshaw, do you confirm that there's a drop in the demand for the first dose of vaccine, and what do you attribute it to?
Sure. So we have seen a slowdown in demand. We do still have first dose bookings happening, so we do still have people coming in for their first dose. So while the rate has slowed, it absolutely hasn't stopped. And I think, again, there's probably a variety of factors. Again, what we're hearing is sometimes people who think that they personally maybe aren't at risk, so don't necessarily see the importance of going to get a vaccine, or perhaps it hasn't been convenient for them. And we are moving, for example, to make some drop-in appointments available. So we'll provide additional information, I believe, on Alberta Health Services website as well as ours, to try to address some of that convenience factor, so people know if they don't want to make an appointment that there are times and places where they can just drop in to get a vaccine when it's convenient for them, as well as making sure that people know the linkage between their choice to get a vaccine, and as we increase that overall population protection, being able to get closer to doing the kinds of activities that are, again, important to all of us and that we've all missed.
Is there a follow-up question?
No, that's it. Thank you.
Thank you all for joining us. Dr. Hinshaw will provide another update later this week. Have a safe evening.